Question number 1. What is the femoral fracture? So the right answer is option D, a break in the femur. Question number 2. Which of the following is a common type of femoral fracture? So the right answer is option C, a transfer, oblique and comminuted fracture. Question number 3. What are the 5 P's associated with leg fracture? So the right answer is option D, all of the above. Question number 6. What is the initial treatment of femoral fracture? So the right answer is option C, cold therapy and pain management. Question number 7. Why antibiotic administration important in some cases of femoral fracture? So the right answer is option A, to prevent infection. Question number 8. Which type of fracture occur when the bone is squeezed or wedged together at one side? So the right answer is option A, compression fracture. Question number 9. Which type of fracture is characterized by break only one cortex of bone? So the right answer is option D, green stick fracture. Question number 10. Which type of fracture occur when the bone is weakened by tumor? So the right answer is option C, pathologic fracture. Question number 11. Which type of fracture is caused by repetitive direct force such as jogging or running? So the right answer is option A, stress fracture. Question number 13. Which type of fracture is characterized by a horizontal break through the bone? So the right answer is option A, transverse fracture. Thank you for watching.